close to 6 million under 5 children and women who die during or around the period of childbirth every year die unnecessarily, because most of the causes that kill these children and women are eminently preventable.
They die early from diseases that women and children wouldn't die from if they were in more developed countries.
Unfortunately, if you live in a country like Malawi, in a country like Liberia, the chances that you die are much significantly higher than in other countries.
We're talking about countries often where there are enormous inequalities in terms of rich and poor, urban and rural access to basic health care.
In the year 2000, when the world bodies came together and said, we want to create some common goals for development, the Millennium Development Goals came out of that to be achieved by 2015.
10 years ago, when we were looking at the progress being made on the Millennium Development Goals, the ones that were way behind everything else were on women's and children's health. The only way to accelerate progress was to do something completely different, totally unexpected.
This was what spearheaded the need for many of us in the community to do what we wrote in the Lancet Child Survivor series, which was the first time when we called for the need of a countdown to 2015.
Bringing together the smartest minds in the world, the best evidence, to force politicians to do the things they needed to do for women and children. That was a decade ago, and look what progress has been made. It's been astonishing.
A lot of the work of the countdown is around tracking intervention coverage. What that means is, in a given country, if you have children who need treatment for severe life-threatening diseases like diarrhea and pneumonia, how many of them are receiving those life-saving interventions? And if they are receiving it, are the poorest of the poor receiving it? Or is it generally targeted to only those who have the resources and are relatively well off?
We came up with the idea to do a report explaining what the level of coverage was for the particular interventions that could prevent deaths. So we developed the first countdown report and developed the first country profiles. So that was sort of the beginning.
These profiles that are very simple, 2 pages with the specific interventions. Then when countries looked at them and were comparing each other, they immediately realized who was doing well and who was not doing well.
You cannot make decisions without information. And you cannot make good decisions without reliable information. We have found that the existence of the countdown mechanism actually goes a long way towards equipping partners at country level with the information that is needed in order to improve the quality of health services.
It really is powerful to use information and data to guide decision-making, to guide prioritization, and to guide where we should be putting the money, and then to also hold everyone and each of us accountable for why we're not getting the results.
In the last several years, Countdown has been supporting teams of investigators working with their partners in country to analyze the complex question, what change was achieved and how was it achieved?
What motivates me to perform this research is a country for myself and my children without needless deaths, with all citizens fulfilling their full development potential.
The case study in Niger has been the first to tell a more holistic story of success in child survival in such a challenging environment. Because in Niger, we found that mortality went from 227 to 127 between 1998 and 2009. Now that's wow, because it's actionable. We look for factors that government can take and act upon and save millions of lives.
where we work very closely with advocates, both at the global level, but increasingly now at the country level, to empower them to talk to governments, talk to those in power, work with those in power, and if necessary, sometimes to also confront those in power to say, look, this is what the global community, the best researchers, the best academics, both from the North and South, as well as the UN, are saying about what's going on. What do we do about it?
You can't just walk into a policymaker's office and say, please increase the budget for reproductive, maternal, newborn, and child health without saying why. Having the research done by Countdown is really what we use to make the case for the advocacy messages we bring.
It's an epiphany moment. They can see that there's a problem, they can measure the extent of that problem, and we can show them what they need to do to advance the health of their own populations. And when you see the direct action that results from data to political commitment, it is utterly remarkable. And that's what Countdown has delivered.
We know that MDGs 4 and 5 will not be met in most countries, and that means going forward from 2015, we need a renewed commitment, renewed accountability frameworks for making sure that this progress we've seen continues.
Yes, we have made progress. And yes, the world is moving on to other goals, such as Sustainable Development Goals. But this isn't game over. We will need to continue to monitor the state and health of women and children worldwide. And we hope that this countdown for 2015 will evolve into a continued countdown as the world aspires to be a better place to live in for our children and the generations that follow.
Thank you.